Topic 2, Infection Control, 25%, 19 questions, focusing on cleaning and disinfecting, implements, equipment, work environment, safety procedures, exposure incidents, patch tests, skin analysis, diseases, and disorders. Let's take a look at some hints and tricks on how to remember this information to prepare for your exam, starting with infection control. The lowest form of infection control is sanitation, and that process is to remove all visible dirt and debris from tools, implements, and equipment by washing with liquid soap and warm water. Disinfection is the process that eliminates most, but not necessarily all, microorganisms on non-living surfaces. The highest form of infection control is sterilization, and that is the process that completely destroys all microbial life, including spores. Here's a hint on how to remember the order of infection control, starting with the lowest to the highest. SAN from sanitation, D from disinfection, ST from sterilization. Your new address is Sand Street. Let's take a look at infection control, focusing on makeup. You want to wash and sanitize your hands always. Do not touch product with your fingers. No double dipping. Remove products with a disposable implement. Distribute on a clean palette before applying. Press powders, you want to scrape with a clean spatula onto a clean palette or clean tissue paper before applying. Never apply lipstick, gloss, or eyebrow colors directly from container or tube. Never apply mascara directly to lashes from container. Use a disposable wand. For our implements, we have our multi-use implements, also known as reusable, and single-use items, also known as disposable. These words can be used interchangeably on your questions for your exam. And as we take a look at the picture on the right here, we will see that all of our implements are multi-use except for the cotton brown. Chlorine bleach solution are in place to destroy bacteria, disinfect implements and non-porous surfaces. Should be mixed fresh daily, every 24 hours, or when soiled. And we have 3 categories for our chlorine bleach solution: low level, high level, and blood and body fluid. Let's take a look. Low level disinfection, you're going to mix 2 teaspoons of household bleach to 1 gallon of water, and you're going to soak for 10 minutes. For a high-level disinfection, you want to add 1/3 cup of household bleach to 1 gallon of water, and you're going to soak for 20 minutes. For blood and body fluid, also known as our 10% bleach solution, you're going to add 1 3/4 cups to 1 gallon of water, and you're going to soak for 5 minutes. The way I remember that is 5 plus 5 is 10, so 5 minutes is blood and body fluid, 10 minutes is low level, and 10 plus 10 is 20, high level. For blood and body fluid, you want to always wear gloves. Your porous implements, you want to double bag and dispose in a closed container or biohazard container. Your non-porous implements, you want to use an approved disinfectant, EPA bleach solution, or household bleach per manufacturer's directions. Never touch a client's open wound or sore. For open wounds, you want to apply an alum septic powder or liquid bandage with cotton tip disposable applicator. For surface contact, spray an approved disinfectant on blood or body fluid, EPA, bleach solution, or household bleach per manufacturer's directions, and remove all visible signs of blood or body fluid. For our hint for skin diseases and disorders, I have a few of our primary lesions listed here: macule, papule, wool, wheal, cyst, tubercle, bulla. And our secondary lesions, I have all of them listed here: fissures, ulcers, crusts, keloids, excoriation, scales, and scars. And if you look at the first letters of each of those, you will see that it spells an interesting acronym. So I promise you, you will never forget the secondary lesions. Want more content over infection control? Please visit Quizlet. We have 2 classes, Esty TDLR and Esty TDLR Exam Prep. Search for Ms. G at Ogle, MSGATOGLE. And on Kahoot, please search #TDLR Written Prep. Next topic is skincare.